You can actually walk into a clinic right now, pay like 900 pounds, and have your most intimate tissues physically aerated with these tiny gold microneedles.
Yeah, and then coated in plant-derived biological software.
Right. It sounds absolutely wild, but while the marketing is, calling it an absolute miracle, medical regulators and insurance actuaries are actually throwing up massive red flags.
They really are. I mean, it sounds like pure science fiction, but this combination protocol is very much a reality in aesthetic and regenerative clinics today.
Exactly. So today we're unpacking a highly specific, rapidly emerging frontier in women's intimate health. We are investigating a fascinating question. Can intimate exosomes be combined with RF microneedling and lasers?
And it's a question a lot of people are asking.
To figure out if it actually works for you, we've gathered a brilliant stack of sources for this deep dive. We're looking at clinical practice guidelines from the Women's Health Clinic, some medical trials, including a really revealing randomized sham-controlled trial.
Oh, that one is fascinating.
It is. We also have official guidance from NICE-DUC, the National Institute for Health and Care Excellence, and surprisingly, insurance underwriting rules from Westminster Insurance.
Yeah, and the insurance aspect is critical here because, actuaries do not care about glossy marketing brochures.
Right, or trademark buzzwords.
Yeah, exactly. They only care about statistical risk, proven evidence, and liability.
We are looking at a space where cutting-edge aesthetics meet incredibly sensitive medical care. It's an area full of big price tags and massive promises. So we're going to strip all that away to find out what the science, the regulators, and even those insurance companies actually say about mixing these high-tech therapies. Okay, let's unpack this.
So to truly understand how this combination works, we really have to start with the hardware.
Okay, the hardware.
Right. When we talk about intimate aesthetics and vaginal wellness today, the clinical tools primarily rely on creating controlled injury. Specifically, we're looking at fractional CO2 lasers, ERYG lasers, and radiofrequency or RF microneedling devices.
Let's break those down a bit because fractional laser gets thrown around a lot. What does the fractional part actually mean when we're talking about intimate tissue?
Think of it like a pixelated image. Instead of burning away an entire solid sheet of tissue, a fractional laser divides the light beam into thousands of microscopic columns.
Okay, I can visualize that.
Yeah, so it drills these tiny microscopic shafts of thermal injury right into the vaginal wall or the vulvar skin, but it leaves the healthy tissue surrounding those shafts completely intact.
Oh, I see. So that intact tissue then acts as like a reservoir of healthy cells to speed up the healing process for the injured areas.
Precisely. And RF microneedling devices, like the Morpheus 8V, which pops up repeatedly in our clinic sources, operate on a similar principle, but they use actual physical needles.
Right.
The Morpheus 8V uses a 24-pin matrix of incredibly fine gold-coated microneedles. These are inserted into the tissue, penetrating up to 3 millimeters deep.
Wow, 3 millimeters.
Yeah, and once they reach the target depth, they release a burst of fractional radiofrequency energy, which is essentially just targeted heat.
I mean, 3 milliliters deep in some of the most reactive, sensitive tissue on the human body. It's basically the same mechanical logic as aerating a lawn.
That's a really good way to picture it.
Like, if your grass is looking thin and the dirt is compacted, you don't just pour water on the surface. You get an aerator to purposefully punch hundreds of little holes into the earth, forcing the roots to wake up, allowing nutrients to get down deep to trigger fresh green growth.
Right. The devices are the aerator. In a clinical setting, they're used to treat conditions like urogenital atrophy.
Which is what exactly?
This is the thinning, drying, and inflammation of the vaginal walls that frequently happens after menopause, when estrogen levels plummet. The thermal trauma from the devices forces the body to rush blood to the area, stimulate the fibroblasts, and basically produce fresh collagen and elastin.
But I have to push back on this entirely. The sources explicitly mention how highly reactive this specific skin is. You're intentionally injuring an area that is prone to irritation and infection, even if they call it controlled. Isn't this inherently risky?
The regulators share your exact hesitation. When we look at the official stances in our sources, there is significant caution at the highest levels.
I would hope so.
Yeah, the FDA, for instance, has issued safety communications warning against the use of energy-based devices for what they call vaginal rejuvenation. They cite a lack of approval for these specific indications and report serious adverse events, including deep burns and severe scarring.
I mean, burns and scarring in that particular area is just a catastrophic outcome for a patient who is just seeking relief from menopausal dryness.
Completely. And the UK's NICE guidance is equally conservative. Their official stance is that evidence regarding the long-term safety and efficacy of transvaginal laser therapy for urogenital atrophy is, well, simply inadequate.
So they don't recommend it at all.
They advise that this procedure should only be used in the context of formal research, not as a standard, everyday clinical offering.
That's a massive detail. If a clinic is selling this to you as a casual, proven spa treatment, they're operating way outside of the official NICE recommendation.
Exactly. And the clinical data we have underscores why that caution exists. There's a fascinating 2023 trial by Page and colleagues in our sources.
Oh, is this the sham trial?
Yes. They took 60 women suffering from genitourinary syndrome of menopause GSM, which causes severe dryness and pain. This was a double-blind, sham-controlled trial.
Right, a sham trial meaning one group got the actual fractional CO2 laser, and the other group got a fake procedure to test the placebo effect.
Right, so the sham group had the probe inserted, the machine made all the firing noises, but no actual laser energy was delivered.
Okay.
At the 12-week mark, the women who received the actual CO2 laser reported their symptom severity decreased by 23.6%.
Which, sounds like a pretty decent win for the hardware.
The catch is the sham group. The women who received zero laser energy, just the insertion of the probe and the sounds of the machine, reported a 13.2% decrease in their symptoms.
Wait, really?
Yeah. Statistically speaking, the treatment response at 12 weeks was comparable between the two groups.
That's incredible. Just the act of going to the clinic, having the area addressed, maybe the lubrication used during the sham probe insertion, and just that powerful placebo effect of receiving high-tech care accounted for a massive chunk of the relief.
It highlights how multi-layered intimate health really is. It's deeply connected to psychology, pelvic floor tension, overall well-being. It's not just a mechanical plumbing issue you can just point a laser at to permanently fix.
Right. So we have lasers and microneedles causing intentional thermal trauma, triggering inflammation, with clinical results that are heavily debated by regulators. Because these devices punch these microchannels into the skin, the tissue is left inflamed and desperately needing support to heal.
Exactly.
And that sets the stage perfectly for the biological software designed to do exactly that. Enter Exosome Therapy.
The software to the hardware's aerator.
When I first read about intimate exosomes in the sources, it honestly sounded like a biohacker's dream. What exactly are they on a biological level?
Think of exosomes as microscopic delivery envelopes that are naturally released by cells. They're tiny lipid vesicles packed with growth factors, proteins, and messenger RNA.
Sure.
Their entire biological purpose is cellular communication. When they reach a target cell, they fuse with it and hand over a set of genetic instructions that essentially say, calm the inflammation, increase blood flow, and regenerate tissue.
So if the RF microneedle is the aerator punching holes in the lawn, exosomes are the high-tech, highly concentrated liquid fertilizer you pour into those holes to force the grass to grow back perfectly without weeds.
That is the exact clinical theory driving the combination. They are applied to stabilize the skin barrier and accelerate healing after the controlled trauma of the energy devices.
But how is this actually different from PRP, platelet-rich plasma? Because we hear about the O-shot all the time, which also claims to use growth factors for intimate healing.
What's fascinating here is the strict rules surrounding how exosomes are used compared to PRP. The sourcing and regulation are completely different, and this is where the Westminster insurance underwriting rules provide brilliant clarity.
Right, the insurance angle.
So PRP relies on your own blood. A clinician draws it, spins it down to isolate the platelets, and injects it back into your tissue. It is your own biology repurposed.
Makes sense.
Exosomes in this clinical context are external products, and Westminster Insurance, which dictates what these clinics can legally be covered for, has implemented incredibly strict boundaries. First, the insurance explicitly excludes application by injection. These exosomes can only be applied topically.
Oh, wow. So you aren't injecting the serum into the tissue, you were just literally wiping it onto the surface of the skin.
Right. And it goes much further. Westminster limits coverage strictly to plant-based and bacterial-derived exosomes.
What?
Yeah, the insurance explicitly excludes human-based and animal-based exosomes for standard cosmetic and aesthetic practices.
Wait, I need to stop you there. This is a massive biological paradox. Human exosomes are banned by the insurers, so the clinics are using plant extracts. How does a plant's biological software even run on human hardware? How does an exosome from, like a rose or a bacteria, know how to tell a human vaginal cell to heal?
I know it sounds crazy, but it comes down to something called highly conserved evolutionary biology. Inside these plant exosomes are microRNAs.
Okay.
Across millions of years of evolution, certain basic cellular functions like defending against environmental stress, UV damage, or repairing a cellular wall have remained remarkably similar across completely different species.
So the molecular shape of the instruction is the same.
Exactly. A plant's microRNA meant to reduce thermal stress has a molecular structure so similar to human RNA that when it's applied to human skin, our cellular receptors actually recognize the shape, read the code, and execute the command. They downregulate the inflammatory response.
That is genuinely mind-blowing. So the insurance companies force clinics to use plant exosomes because human-derived biological products carry risks of, what, disease transmission?
Disease transmission, immune rejection, and just massive regulatory hurdles. Plants don't carry human bloodborne pathogens.
Right. It is entirely a risk mitigation strategy by the actuaries.
Yeah.
So the exosomes being used in these treatments, which often cost between 699 and 895 pounds per session, are topical, plant, or bacterial serums.
Correct.
But if these highly expensive serums are essentially just sophisticated plant extracts that you rub on the skin, are clinicians actually seeing enough real-world benefit to justify combining them with the heavy-duty lasers?
They are, and the Women's Health Clinic guidelines detail exactly why. It basically comes down to solving one of the most frustrating challenges in intimate aesthetics:
Which is?
post-inflammatory hyperpigmentation, or PIH.
Okay, PIH is the darkening of the skin around the vulva, bikini line, or inner thighs, right?
Normal genetic variation accounts for a lot of this, but PIH specifically is caused by trauma. Friction from clothing, shaving, waxing, or low-grade dermatitis inflames the skin. When the skin heals, especially in melanin-rich skin, what dermatologists call Fitzpatrick skin types 4 through 6, the inflammation triggers the melanocytes.
Those are the cells that produce pigment.
Right. The skin perceives the inflammation as an attack, and it defends itself by pumping out melanin, causing the area to darken.
Here's where it gets really interesting, because this is the contradiction of the hardware.
Yeah.
If you have a patient coming in to treat dark patches, and you use a thermal laser to resurface the skin, you're creating intense heat and trauma. It feels like sandblasting a wall to remove a tiny stain. You're just creating a rougher, more damaged surface that's going to catch more dirt. The laser's inflammation should just trigger more PIH.
That is the greatest risk in treating intimate pigmentation. If you overtreat or overheat melanin-rich skin with a laser, you will absolutely backfire and make the dark spots significantly worse. The melanocytes will just panic. This is the exact loop of destruction the combination therapy is designed to break.
So how does mixing in the plant exosomes actually solve the melanocyte panic?
Synergy allows for moderation. By combining the therapies, the clinician doesn't have to blast the skin at maximum power.
Oh, I see.
Yeah, they can use much lower, highly conservative settings on the laser or the RS microneedling device. They gently create the microchannels, then they immediately apply the topical exosomes.
Ah, because the skin has been aerated, the exosomes don't just sit on the surface. The microchannels bypass that tough outer epidermal layer, allowing the plant RNA to sink deep into the tissue.
Yes. The microRNAs instantly begin signaling the cells to shut down the inflammatory cascade. By rapidly cooling off the biological alarm bells induced by the laser, the exosomes heavily reduce the risk of the melanocytes overproducing pigment. You get the targeted tissue remodeling and collagen synthesis from the laser without the hyperpigmentation rebound.
It's just such an elegant biological hack. High-tech microdestruction instantly neutralized by cross-kingdom biohealing.
But, if you're listening to this and sitting there thinking this combo is the ultimate flawlessly engineered fix for your intimate health, we need to take a step back.
We do, because we are still talking about intense medical procedures here, not a casual spa facial.
Let's look at the hidden hurdles. If a listener is thinking about booking this, what are the strict contraindications? Like, who is absolutely disqualified from getting this combination?
This raises an important question, and anyone with an active infection is immediately disqualified.
Right, that makes sense.
If you have bacterial vaginosis, thrush, or an active STI, the intentional trauma from the microneedles or laser can cause that localized infection to spread rapidly. But the viral triggers are even more complex, particularly regarding the herpes simplex virus, HSV.
Which a huge percentage of the population carries, even if they haven't had an outbreak in years. Exactly. The virus lies dormant in the nerve ganglia. Any procedure that causes localized heat or physical trauma, like an RF needle delivering a burst of energy, can shock the virus out of latency and trigger a severe herpes outbreak across the treated area.
The heat literally wakes the virus up. If someone has a history of HSV, what's the protocol? Do they just avoid the treatment entirely?
Standard medical protocol requires prophylactic antiviral medication, like acyclovir. You typically have to start taking it 2 days prior to the procedure and continue for 5 days after,
Just to suppress it.
purely to suppress the virus while the tissue recovers from the laser trauma.
So I've got viral triggers and infection risks, but what about the patient's own biology? Like if someone's on standard daily medications, does that impact the regenerative side of things?
It massively impacts it, especially if the clinic is trying to use PRP alongside the hardware. If you are taking blood thinners, warfarin, DOACs, or even over-the-counter supplements like high-dose aspirin or omega-3 fish oils, you basically hit a wall.
Because thinner blood just means you bleed more when the needles go in.
It's actually deeper than that. The regenerative aspect of therapies involving blood relies on the body's natural clotting cascade to release growth factors.
Oh, I see.
Blood thinners purposefully interrupt that clotting response. If your blood cannot clot and cascade normally, the regenerative mechanism simply fails to trigger. You are undergoing the trauma and spending the money, but your biology cannot execute the healing phase.
That is a vital detail that is usually buried in the fine print. You could be perfectly healthy, but your daily fish oil supplement means the biohack won't even work.
Right.
What about hardware clashes? Because we are talking about directing energy devices into the pelvic region, where a lot of women have other medical devices implanted.
This creates one of the most fascinating physics problems in our sources. So many women use a copper IUD for birth control.
Yeah.
If a patient has a copper coil, using a fractional laser or RF device internally is generally considered safe. The thermal energy simply doesn't penetrate deep enough through the vaginal wall to reach the uterus where the copper sits.
So lasers and copper coils don't interfere with each other. Good to know.
However, there is another highly popular treatment often found in these exact same clinics. The M-Cella chair.
The Emsilla chair, yeah.
It uses high-intensity focused electromagnetic energy, or HIFEM, to force the pelvic floor muscles to contract thousands of times in a few minutes.
It's essentially a giant magnet you sit on to build pelvic floor strength.
And if you have a copper IUD, sitting on that chair is an absolute contraindication. It comes down to Faraday's law of induction.
Oh boy. How does the physics play out inside the body?
A rapidly changing magnetic field, like the one generated by the HIFEM chair, induces electrical eddy currents in conductive metals.
And copper is highly conductive.
Exactly. The magnetic field can induce a current in the IUD, which can generate localized heat inside the uterus, or create mechanical torque, potentially causing the device to violently dislodge.
That is genuinely terrifying. It completely shatters the illusion that these are just superficial beauty treatments. You are dealing with electromagnetism, thermal trauma, and viral latency. It's so important to remember before you book a consultation that you have to disclose every single medication, supplement, and implant to your clinician.
Transparency is non-negotiable. And that brings us back to the clinical reality of the exosomes themselves. Reputable clinicians, following guidelines like those from the Women's Health Clinic, are very clear. Exosomes are still an investigational frontier in cosmetic dermatology.
The science is promising, but the jury is still out.
The manufacturing standards and the quality of clinical studies vary wildly. While plant-derived exosomes are a brilliant biological concept for mitigating laser-induced hyperpigmentation, they are not a magic eraser.
Right.
Leading clinics are incredibly careful not to guarantee results. When you pay that £900, you are paying for cutting-edge possibility, not a clinical certainty.
Let's zoom out and summarize what we've discovered. Can intimate exosomes be combined with RF microneedling and lasers? Yes, it is a real, actively practiced synergy aimed at solving a specific problem.
The hardware, the fractional lasers, and the gold microneedles creates the necessary microchannels and intentional thermal trauma to stimulate collagen production and remodel aging tissue.
And the software, the topically applied plant or bacterial exosomes, uses highly conserved evolutionary microRNA to slip into those channels, speak directly to the human cells, and rapidly calm the inflammation.
Exactly.
This combination allows clinicians to treat the tissue while suppressing the melanocyte panic that causes dark spots in melanin-rich skin.
Yet, it remains an emerging, heavily regulated space. The insurance coverage is tightly restricted to non-human topicals. The regulators like NICE advise extreme caution, and the risk factors from waking up dormant viruses to magnetic interference with IUDs require rigorous medical screening.
True intimate wellness rarely begins with 24-pin gold needles and investigational plant serums. Official guidance from the specialist almost always points back to the foundation first.
It does.
If you are dealing with menopausal atrophy or dryness, the proven gold standards are topical estrogens, body-safe moisturizers, and pelvic floor physiotherapy. You optimize the basics before you escalate to the biological frontier. So what does this all mean?
Well, as we move toward a future where our cells are constantly being reprogrammed by exogenous software, where we literally aerate our tissues just to pour in plant RNA to force them to heal, we have to wonder about the long-term trajectory. At what point does the human body adapt to this constant intervention and stop knowing how to efficiently heal itself without a 900-pound biohack to kickstart the process? Are we trying to heal a medical condition, or are we slowly turning the natural aging of the human body into a cosmetic canvas that constantly needs renovating?